Welcome to Modern Group of Institution. Today in Pharmacology second BP503T we study about hematinics. Basically, what are hematinics? Hematinics are the substances that required for the formation of blood and are used in the treatment of various type of anemia. Now, what is anemia? Anemia is a condition in which the concentration of the blood, in which the concentration or we say the number of RBC inside the blood decreases. So basically different type of anemia, pernicious anemia, megaloblastic anemia, various type of anemia, and in various type of anemia we use hematinics. All hematinics agent stimulate the production of RBC and increase the amount of hemoglobin in the blood. As we all know, hemoglobin is responsible for the carrying of oxygen. All hemoglobin molecule, a single hemoglobin molecule carry 4 molecule of oxygen. First of all, in the hematinics we study about iron. Iron is an essential mineral that is required for human life. Much of the iron in the body is found in the RBC. Most of the iron in our body is found in the RBC. In our body, hemoglobin contains 66% of iron, and iron is stored in our body as ferritin and hemosiderin, that is 25%. Iron is also present in our proteins, that is known as myoglobin, and the concentration of iron inside the myoglobin is 3%. Other iron, that is parenchymal iron, in our body is 6%. The daily requirement of iron in an adult male is 0.5 to 1 mg, and in female it requires 1 to 2 mg. Why in female the amount of iron daily requirement is more? Because every month the woman goes with the menstrual cycle. Therefore, the daily requirement of the iron in adult female is 1 to 2 mg. In infant, it is 60 mg per kg, and in children it is 25 mg per kg, and in pregnant and lactating woman it is 3 to 5 mg. Now, coming to the iron absorption, the major part of the dietary iron is in the form of inorganic or in the form of ferric iron. It needs to be reduced to the ferrous form before absorption. Iron is not directly absorbed in our body in the form of ferric form. It is absorbed in our body in the ferrous form only. Absorption occur all over the intestine. Mainly, the small intestine is responsible for the absorption of the iron. Now, if we talk about the transportation, utilization, and storage and excretion of iron, iron is transported into the erythropoietic and other cells. Erythropoietic cells are those cells which produce RBCs. Now, if iron is dissociated from a complex at an higher acidic pH of intracellular vesicle, iron will dissociate into into the complex with the help of acidic substance and release in the form of hemoglobin synthesis. Iron is basically stored in all cell, and inside the cell it is get stored into the reticular endothelial cells of liver, spleen, bone marrow, and other hepatocytes and myocytes as ferritin. Iron is excreted through sweat, very little amount in urine, with some amount by desquamated skin, and in some RBC it is excreted in the form of bile, that is in the bilirubin and the biliverdin, in and lost in the feces of our body. Now, if we are talking about the preparation and doses of iron, iron is given to the patient in the form of oral or in the form of parenteral medication. If we talk about the oral iron, ferrous sulfate at 200 mg tablet is available in the market. Ferrous gluconate, that is available in 300 mg and 400 mg, as well as in 15 ml oral syrup. Ferrous fumarate, it is also available in 200 mg tablets. Colloidal ferric hydroxide, that is available in 200 mg tablet, 400 mg tablet, 5 ml liquid, and 100 mg drops for the infants. Iron is also available in the parenteral form, that is in IV and IM injections, that is iron dextran and interferon injection, that is 2 ml ampule is available in the market. Iron is also available with sorbitol citric acid complex, that is 1.5 ml ampule. Excessive use of iron, it may cause, or the adverse effect of the iron, that is the epigastric pain, that is in the portion of upper greater curvature of the stomach. It may cause heartburn, acidity, nausea, vomiting, and your mouth will taste like a metallic taste. Everything you will eat, you just feel the taste of metal, and it will also cause the constipation. What are the basic dietary source of the iron? The iron is present, basically the rich source of iron is liver, egg yolk, dry beans, dry fruits, wheat germs, and yeast. The medium source, that is the meat, chicken, fish, spinach, banana, and apple, are the medium source of dietary iron. The poor source of iron are milk product and rooty vegetables. Now, why iron is need in the need of iron in our body? As we all know, the iron is responsible for the formation of various type of vitamin inside our body. The iron is responsible for the maturation factor of various vitamin like vitamin B12 and folic acid, which are vitamin B groups vitamin, result in megaloblastic anemia. If the iron is not present in our body, it do not produce vitamin B12 and folic acid and result in the megaloblastic anemia, that is large red blood cells precursor is unavailable. And vitamin B12 and folic acid are the maturating factor which is responsible for the formation of the hemoglobin inside the bone marrow. Now, if we talk about the vitamin B12 is also known as cyanocobalamin and hydroxycobalamin. These are the complex cobalt containing compounds which are present in our diet and referred as vitamin B12. Daily requirement of the vitamin B12 is 1 to 3 mg, and for the pregnant and lactating woman it is 3 to 5 mg. Now, the utilization, how the vitamin B12 is utilized in our body. Vitamin B12 is transported in blood in combination with specific bleed globulin, that is known as transcobalamin second. Vitamin B12 is taken up by the liver cell and for stored for 2/3 and 4/5 hour for our body contained inside the liver, and it is mainly excreted with the help of bile juice and urine. Now, if we talk about the doses of the cyanocobalamin or vitamin B12, it is 35 mg per 5 ml liquid, or it is 100 mg injection, 500 mg and 1000 mg injection are available in the market. The another form of the vitamin B12 is hydroxycobalamin, that is 1000 mg injection is available in the market, and one another form of vitamin B12 is methylcobalamin, that is 0.5 mg tablet is available in the market for the pregnant woman, for the lactating woman, and for the patient which are suffering from anemia. Now, the another hematinic is folic acid. Folic acid is generally a yellow crystal which are insoluble in water, but their sodium salt are freely soluble in water. The daily requirement of the folic acid inside an adult, it is less than 0.1 mg, but up to 0.2 mg per day can be used by an adult man. During pregnancy and lactation, 0.8 mg per day can be considered as appropriate for the normal growth of the fetus and for the lactating woman. How the utilization of the folic acid takes place inside our body. The folic acid is present in food as a polyglutamate. This polyglutamate residue break down in the upper intestine before being absorbed. Now it is transferred is it is transferred as methyl THFA, that is tetrahydrofolic acid, which is partly bound to the plasma protein. Folic acid in the cell store as polyglutamates. Liver liver is mainly take up all the folic acid and secrete methyl THFA in the bile, which is mostly reabsorbed from the intestine. The doses of the folic acid, that is 5 mg tablet, is available in the market. The therapeutic dose is 2 to 5 mg per day. And for prophylactic treatment of the anemia, 0.5 mg per day folic acid can be given. Folinic acid, that is known as calcium leucovorin, 3 mg per ml injection is given to the patient suffering from megaloblastic anemia. Deficiency of the folic acid leads to malabsorption and chronic alcoholism. Now, vitamin B12 cyanocobalamin do not give to the patient suffering from any gastrointestinal disease. Iron best given into the empty stomach, but food presence of food decreases its absorption. Assess hemoglobin level and bowel movement, as constipation is common adverse effect of the iron. Folic acid is contraindicated in the pernicious anemia. Thank you very much.